Greetings to everyone today in Natural Heart Doctor. Thanks for being on. I'm Dr. Jack Wolfson, board certified cardiologist, natural heart doctor. I spent 10 years in medical training, which included 4 years of medical school, 3 years internal medicine, 3 years of cardiology. Spent 10 years in the biggest group in Arizona as a hospital-based cardiologist. And for the last 7+ years, I've had my own practice, Wolfson Integrative Cardiology in Arizona, where people from all over the world come out to see me. And we also offer phone conversations as well to really dial in your heart health issues. So again, a lot of different options for you to recover your heart health. We got my book, we've got tons of blogs, we've got a lot of videos, and we have the possibility for you to work with me personally or one of my health coaches. So hello to Caitlin and Ellen and Lorena. Thank you so much for being on. Today I want to talk about CT scans and your heart. So we're going to get into that in a little bit. But again, I'm Dr. Jack Wolfson, board certified cardiologist. And there was a study that I just posted to Facebook, and I'll make sure I put it up into Natural Heart Doctor as well, about how fish eaters have a lower risk of dementia. Those who eat fish have a lower risk of dementia. Why? Because the proteins in the fish, the fats in the fish build our brain, and we need it in our diets. So I recommend eating sardines, anchovies, wild salmon. I recommend eating shellfish. Those really, really boost up brain function, prevent dementia, are so important for the children as well. So we need to get seafood into the diet. One of my little hacks to get that into the kids is to put anchovies in the blender along with olive oil, lemon, fresh garlic, herbs and spices. You can throw a little bit of avocado in there to make it a little bit creamier. You can throw in just kind of this whole kind of hodgepodge of healthy things into the blender, blend it up along with those anchovies, and just explode brain function. It's so, so important. And so many different studies. And even if you're a vegan out there or you're a vegetarian, I would highly recommend you switch over to adding seafood into your diet. So right now we're inside Natural Heart Doctor, and I do want to talk to you about the importance of not doing things that are detrimental to your health. We are all about building the body up, improving the function of the body. And we do so, of course, naturally. If we give the body the tools it needs to get the job done, we are essentially bulletproof. We do not need the pharmaceuticals. We do not need the procedures. If we keep ourselves healthy. There's always a time and a place for trauma, but when it comes to real prevention, the medical doctors have nothing. On our side, Mother Nature, we have everything. So it takes me to my next point. Why do so many doctors recommend CT scans? Well, CT stands for computerized tomography. It used to be called CAT scan. Sometimes it's referred still as CAT scans, CT scans. They're synonymous. And what it is that they use a computer to create improved imaging of X-ray technology. So you go into a tube and you get blasted with X-ray, and then the computer uses those X-rays to generate sometimes a beautiful 2-dimensional image or even a 3-dimensional image, again, to give you a little more spatial awareness, if you will. And the doctors are using this in the case of CT scans of the chest in order to diagnose coronary artery calcification. And this technology started about 20 years ago. And I remember when I was a cardiology fellow, and as a cardiology fellow, they came in and told us the reps for these companies, that Medicare was paying for it, and everybody's getting it. And then quickly soon after, Medicare did not pay for it. Insurance companies did not want to pay for it because they realized what was happening is that the use of CT scanning was identifying a lot of people with coronary artery calcification. And those people were all therefore guided into upsells. They were, and by that I mean stress testing, nuclear stress testing, echocardiograms, invasive angiograms, ultimately coronary artery bypass surgery or stent procedures in many of those cases, and they were unnecessary. The person never had symptoms. So take me as an example. I'm 49 years old, so I go in for a CT scan, and I see the doctor sees that there's coronary artery calcification, and then they told me, well, now you need a stress test. Okay, you're the doctor, I get a stress test, and maybe there's something abnormal with that. So now I get a nuclear stress test, or that leads to an angiogram. All the while I'm feeling fine, I've got no symptoms. I run up mountains, I bike all over the place, I'm active with my family, I'm having no symptoms, and now I'm kind of marching down this path into a stress test and an angiogram, and maybe even ultimately bypass surgery when I never had symptoms. And the reality is procedures can be beneficial. Stents and angioplasties and bypass surgery can be beneficial for people with symptoms. So if you don't have symptoms, then you don't need any of these you don't need any of those other tests, and I talk about that in my book. Okay, take me back to CT scans now. So the question is, and where it stands right now, is that the companies, or the medical doctors, well, I mean, and let me say this, the premise is, of course, is that coronary artery disease is the most common medical condition in the world. Millions of people, of course, are dying in the United States and beyond. So the MDs recommend a CT scan. And again, the most current up-to-date recommendations by some of the leaders are telling us quite simply that they recommend CT scans if it will change what your therapy is going to be. So if you have a CT scan that shows that there is some amount of blockage, they're going to recommend statin drug therapy. If the CT scan shows that there is no evidence of coronary calcification, then they're saying you have other options. You don't necessarily have to go on statin drugs. So essentially, any test you're going to have, no matter what that test may be in whatever field that is it going to change the plan for you? Is it going to change health outcomes? Or is it going to change decisions as to what you're going to do? Are you going to take statin drugs or not? Are you going to take aspirin or not? So that is really what the recommendation is. And clearly, the more coronary calcification you have, the higher your risk. I agree with that, but I don't agree with CT scans, because to me, CT scan will not change how I approach a patient. I still approach the patient in the same way. Nutrition, lifestyle, the most advanced testing in the world, evidence-based supplements. That's what we do. Now, again, what happens is that what are the downside of having a CT scan? Well, of course, there's a downside. If there was no downside and only upside, then I would say go ahead and have it. But of course, there's a downside. Number one, you're getting a massive dose of radiation. Sure, the doctors will say, well, it's not that much, or you get more when you fly, 50 flights, from the United States to Tokyo or something like that. To me, any radiation is bad radiation. We need to avoid it as much as possible. So certainly avoid it in this scenario where it's not going to change how we approach you. We're not going to recommend statin drug therapy to you. So the CT scan, again, with the radiation, this ionizing radiation kind of comes into your body as think of it as like a wave that comes in and hits your body. It hits your DNA, it hits all of the cells, it hits all the proteins. It can change anything and everything. And we know from the literature, the more CT scans people have, the higher their risk of cancer. The more CT scans you have, I believe, the higher the risk of coronary artery disease, because you're damaging those tissues. The more CT scans you have, the higher the risk of dementia, because again, you're damaging brain tissue. It is a massive amount of radiation that you don't need, because again, If you have coronary calcium or not, it's not going to change how Dr. Jack Wolfson would approach you. Next, sometimes whenever you have another test, they always find something else. So if they do a scan of your chest, they'll find a spot on your lung. They'll find a cyst in your liver. They'll find maybe a nodule on your thyroid. It just begets other tests on and on and on. And that's a problem. It's a problem because that leads to a lot of stress. It leads to a lot of anxiety, and it's not saving lives. It's not saving lives by just, there's never been any study that said, well, scanning the whole body up and down and getting MRIs or CT scans on an annual basis prevents anything. It causes bad stuff because, again, the radiation is so damaging. As I said before, another downside of this is that tests beget tests. Again, if they find something in your thyroid, now you're getting a thyroid ultrasound. Now you're getting a biopsy. That's inconclusive, and now you're getting your thyroid removed. Spots on the kidney, spots on the liver. There's always spots everywhere in our bodies. That's just the way it is living in the 21st century. Of course, tests beget other tests in a cardiac space. So when you have a CT scan that shows coronary calcification, the cardiologists jump all over that. Stress tests, nuclear scans, invasive angiography, stent, bypass surgery. That's just the way they roll because it's a money-making factory, which is essentially why so many big institutions offer the CT scan for such a low price. Insurance won't cover it, but you can maybe get it for $49, $99, $199 because you're going to have abnormalities, and now they've got you in the system. Now they can do other things that insurance will cover based on the diagnosis of coronary artery disease. And then also, fundamentally, what if your score comes back and it's totally normal? Should we continue drinking and smoking and eating fast food, cookies, cupcakes? Should we continue not exercising? Should we continue with poor sleep habits? Essentially, it leads to us being complacent, having a false sense of security, and that would be bad. Because just because you don't have any coronary artery calcification or disease doesn't mean you can't develop cancer, diabetes, stroke, autoimmune disease, you name it, brain diseases from your unhealthy habits. Or maybe your scan is 0 right now, but what's it going to be a few years down the road with your continued behaviors? Okay, so how does the information change their plan? Again, the information doesn't really change their plan. They essentially recommend statins to everybody, so it could be either moderate dose statins or high intensity statins. How does the information change my plan? It doesn't change my plan either. The only thing is that, the only thing that if somebody came to me and they already had the scan, I'm not going to berate them for doing it. I will advise them to not do it again, but I will maybe take a more, use that information to get more aggressive with them and to push them to say, hey, you are already filling up with coronary artery calcification. We need to take this more seriously. So in that sense, the test could provide value if it can be used to spur people to healthier lifestyle choices. But at the same point, I don't want to damage the body in order to try and get someone to lead a healthier lifestyle. That's just not the way I roll. So the information doesn't change my plan. I'm still going to tell you to eat organic paleo food. I'm still going to tell you to go to sleep when the sun goes down. I'm still going to tell you to get plenty of sunshine. I'm still going to tell you to be physically active. I'm still going to tell you to avoid stress. I'm still going to tell you to avoid environmental chemicals and pollutants. I'm still going to tell you to practice mindfulness and whether it's meditation or it's yoga or it's Tai Chi. I'm still going to tell you to get outside in nature. I'm still going to tell you to get evidence-based supplements, and I'm going to tell you the test that you really need, which is not the CT scan. The testing that you need are advanced lipid analysis, advanced markers of inflammation, oxidative stress, micronutrient testing, all those things that we offer on our website. That's the kind of stuff that I'm telling people to do. Laura Beth Sheets, good morning. Michelle O'Brien, Carrington. I believe that's pronounced Beauchamp. I'm not sure. And then Laura Beth, again, Laura, and then everybody else who's on. Thank you, thank you. So one place you could go is the doctorswolfson.com /tests. And that's all the different tests that we recommend overall. And then we can go to the doctorswolfson.com /cardiovascular dash tests. And that'll give you the test that we recommend for everybody. And that can be done through my office. It can be done through your local doctor. Those are all the tests that I recommend, and I update things certainly as new things become available. So what else? So that's pretty much it. Hello, Deborah Bohan. Hello to you. So it's great to be on with everybody. This whole presentation was all about CT scans. Beware the CT scan. If you already had it, I'm not here to admonish you for doing so. I don't want you to do it again. I want you to take that information and go moving forward. But the most advanced testing in the world is what you really need to do. Don't get radiated don't get radiated, period. Radiation causes heart disease, cancer, brain disease, you name it. That radiation comes into the body and just leads to damage, just damages all tissues that it comes across. If you are going to have a CT scan, despite everything that I've told you, or the CT scan is happening for any other reason, maybe you need a brain CT or abdominal CT or whatever, then we want to make sure we get you on a good protocol to recover after a CT scan. And I've got blogs on that, but essentially loading yourself up with antioxidants is really what the key is here in this scenario. So we want to get you on our daily greens powder, our daily defense powder, our superfood powder. You can mix those all up into a delicious shake or smoothie and just continue on with super duper health. So I'm open to any questions now or in the future. We'll keep an eye on this here. Again, so Megan said, what do you recommend for detoxing after a CT scan? So essentially, you have to give the body all the tools it needs to repair after a CT scan. And the three products that I mentioned, the Daily Greens, Superfood, and Daily Defense, those would be my powders that I recommend to use after a CT scan. I'd probably, if it was me doing it, I would probably do the dosing recommended on the bottle and do that 2 times a day. So typically that's going to be 2 scoops, and the scooper is inside the Daily Defense, inside that vanilla chocolate or chocolate delicious shake. If you take 1 supplement, it should be my Daily Defense. It is absolutely outstanding and it tastes amazing. Great testimonials on that as well. So Daily Defense, Daily Greens, and Superfood, and you mix those all up together. And the 2 scoops of the Daily Defense, 1 teaspoon of Daily Greens, or maybe 1 heaping teaspoon, 1 teaspoon of Superfood. Do that 2 times a day and you will be well on your way. Of course, getting sleep and getting sunshine and all the healthy stuff that we need to do anyways. So and of course, see your doctor of chiropractic, get adjusted, make your primary care doctor your doctor of chiropractic. That's the way to go. Megan, hopefully that answered your question, and that can be for a coronary CT scan or any CT scan that people are doing. So I do have a blog post on this called Beware the CT Scan. You can share that post. You can share this video. I will download it and upload it onto YouTube. You'll be able to share it then. You can't share this outside of Natural Heart Doctor, but you'll be able to share it with friends and family that are thinking about CT scans. So there we go. Have a great Tuesday. I'm Dr. Jack Wolfson, Natural Heart Doctor. We'll be back with another episode next week on Natural Heart Doctor. Topic to be decided, but I promise you, it's going to be fantastic. It's going to be hopefully life-changing information for anybody and everybody. And again, I certainly appreciate Deborah. The key to preventing kidney stones really is to use a lot of potassium-based products to help to alkalinize the urine. And the best way to do that is with our Potassium Boost product, which contains potassium citrate, which helps to decrease your chances of kidney stones. Lots of different strategies, increasing magnesium. I've got posts on kidney stones as well. I've never had one patient of mine ever come back to me with probably 1,000 people that take daily greens, and none of them have had a kidney stone episode. So there are some things in there that may contain oxalates, but I can't say it's certainly not a high oxalate product. But again, I think that people have kidney stones for a variety of reasons. I don't think it's a high oxalate diet that is the cause. I think oxalates in combination with other unhealthy lifestyle practices is going to be what the cause is. So, Derek Elwart, you just joined, but you're going to have to watch the replay. I am out. Dr. Jack Wolfson, Natural Heart Doctor. Thank you so much for all of you being in my life, and hopefully for getting the message out of holistic heart health and wellness. See you next week.